Medical service personnel say they've never seen anything quite like it, the human toll wreaked by the Delta virus. And it seems to be getting worse with numbers spiking dramatically. Paramedics are often first at the scene of a medical emergency. They say they are increasingly having to choose who to save and who to let go. So let's check in with one of them, ER24 spokesperson, Russell Mehring, to find out what's happening out there tonight. Russell, very good to have you with us. I know you're a busy boy, so I'm not going to keep you for long. Tell us what's happening tonight. What is it that you are seeing?
Thank you very much for having me. Well, as you said earlier in some of the previous interviews, obviously the entire health sector is at strain with the increasing numbers. I think today was above 17,000. So whether you are in the private sector or in the government sector, I think everyone is pushing hard to try meet the demands that are out there and try to treat and respond to every single patient.
I should imagine that you've seen a dramatic uptake. Tell us how you operate, how many cars are out there, what sort of experiences the medical personnel from your side are having.
I think for every sector it's been very, very busy. Obviously with the vaccination of the frontline workers has put a lot of the staff at ease. Obviously there is still a very big risk to emergency personnel out there, and obviously we are taking every precaution to make sure that our staff are safe, as well as any patients that we may come across. Obviously we have to make sure that they are treated to the best of our abilities, as well as kept safe during this pandemic.
I should imagine, I mean, I know you see a lot of trauma, but I should imagine it must be pretty traumatic seeing so many sick people, so many people struggling to breathe. How do you all cope with that?
Well, absolutely. We have in our system a number of healthcare workers that are able to assess our staff and make sure that they aren't taking strain. Obviously, we have a vast amount of vehicles out there and a vast amount of paramedics that are going out to the patients. But the numbers that we are seeing now put out by the Department of Health is obviously increasing daily. And all the services working together are trying to treat and meet these expectations and these demands. Obviously it puts strain on our services and it puts strain on our personnel. So this is why we are obviously doing mental health checks on them, making sure that they are still able to cope during this time.
And tell us about how it works with hospitals and the communications there, because I've been hearing that many ambulances or, many of these emergency services are getting to hospitals and being told that there aren't enough beds. How does that work?
Things like this can be very difficult, obviously, with the increasing numbers. So ER24, and I'm sure a lot of the services out there, including the Department of Health, will liaise with each other and find out where there are appropriate facilities to send to the patients. There's always a follow-up with any patient. You can't just arrive at a hospital expecting that beds are available, especially during now. So this is why systems have been implemented that, you follow up with hospitals, see where there are services available to take your patient.
All right, and I know that South Africans we bad at drunk driving. Will the curfew help in any way to enable you to focus better on COVID-19 patients and their needs?
I believe so. Generally, our numbers have been rather high, especially during your festive seasons, holiday times, and your payday weekends. So I think the curfew should, theoretically, lower the numbers. Obviously, people won't be staying out as much. And again, this is always something that ER24 does, is we urge members of the public that should you go out, obviously not breaking the curfew, but should you go out and consume alcohol, to rather utilize a taxi service to get home safely, or a buddy system, or rather do it at home. Obviously, you shouldn't be going out, especially with these numbers climbing, shouldn't be going out to restaurants or venues where you could put yourself at risk. So rather, if you do feel like a drink or two, rather do it at home in the safety of your own house, where you are not going to put yourself at risk either from drunk driving or from COVID.
Can you give us a sense tonight how many of you are out there and how many calls you've received?
Offhand, I don't know how many calls we have received. It obviously climbs. We have around 300 operational vehicles that are currently running, with numerous staff all around South Africa. So we are working very, very hard at the moment.
All right, Russell, well, thank you very much for talking to us and updating us, and obviously we wish you all strength and, goodwill from all of us, and big thanks.